Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, comprehensive chat by the Islamic Medical Association, your regular Tuesday medical slot. And tonight we've got a program on breast cancer and its prevention and diagnostic techniques. I'll introduce you to the guest just now. Assalamu alaikum to Dr. Nadia Jajbai, who is a specialist radiologist with a dedicated mammography and breast cancer screening unit in Kilani and a wellness center for women. Assalamu alaikum, Doctor.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you for having me.
Alhamdulillah, alhamdulillah, Rabbil Alameen, wal aqibatu lil muttaqeen, was salatu was salamu ala ashrafil mursaleen, Sayyidina Muhammad wa alihi wa ashabi ajma'een. Allah says in Surah Shura, which is the 26th Surah, verse 80, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ. And when I am ill, it is He who cures me. And it is obviously, we know that it is only Allah who can cure us, and it is part of our faith that we rely on Him totally. But the body has been given to us as an amana and as a trust, and we need to look after it. So before disease sets in, and before we need that cure, we need to detect the disease and look after the body. And we have to engage in some kind of preventative techniques. And when it comes to breast cancer, which is a breast cancer month this year at the moment, and breast cancer being the leading cause of female cancer in South Africa, we thought we'll discuss preventative and screening techniques for this very, very common condition. And that's the reason we've chosen this topic, and we've got an expert in this particular field, Dr. Nadia Jazba. So Nadia, just to start off the discussion, what would you say in terms of the current incidence of breast cancer, and why is it so important? It has taken over cervical cancer and it's become such a prevalent disease in South Africa.
Bismillah ar-Rahman ar-Rahim. Yaqub, I think we're in a very alarming time of breast cancer because we're seeing an increase in incidence amongst very young women. But in South Africa, to overtake cervical cancer, we know that there's a significant disease burden of breast cancer. It's no longer a cancer of old white women, and that's what it was thought to be. It now does not discriminate between age, race, and yes, gender. It's commoner in women, so men are not completely exempt. However, this cancer does not discriminate, and we can all be affected.
So we've got a slide that actually just shows how the media is actually trying to highlight this and assisting us. I think they're doing a very good job in trying to promote awareness. And this is just an example of some of the print media publications, and of course there's a lot on TV, and there's quite a bit happening in radio stations, community radio. Do you think, in your opinion, that enough is being done to create awareness in the public forum?
Look, Yaqub, I think compared to about 2 decades ago, yes, there is increased awareness. I do believe that more needs to be done across the board, politically and in the media. We do have ambassadors that are famous that have brought breast cancer to us to say that it can affect anybody, and it has brought the awareness to us. However, I do believe that the impoverished communities still need to be sufficiently targeted, because there is where the problem of later detection exists. Yes, we've increased our resources in public health sector. So we've got beautiful centers now within our main public hospitals that are offering screening. However, will you come in for screening? Your awareness when you are still limited by transport, by
socioeconomic factors.
Your socioeconomic factors and finances, and really fear is a common factor across board.
Okay, that's very good. I mean, look, in terms of the actual incidents in your practice, obviously we're saying that there's two different populations with most things in South Africa. You've got the private healthcare and then the public sector. A lot more needs to be done in the public sector because there are many constraints. But when it comes to the private sector and over the years that you have practiced,
Yes.
are you seeing more females coming through to you directly, and then also others being referred to you by people like myself or whoever else is referring to you through your network? Has there been an increase in the numbers?
Alhamdulillah, there is an increase in incidence. So women come in for screening commonly because a loved one has just been diagnosed, a friend has been diagnosed, or they've read up about breast cancer. So in the media and Professor Google is a very strong driving force. However, I don't believe many women still come through because of the common fear factor that exists. As far as referral base, I think on the whole, our GPs and gynecologists are very good in their practices by giving a complete screening for their patients. However, I do believe that many women are not having their annual checkups and are not presenting to gynecologists for their annual gynecological workup. And that's part of my practice. I smile like that because all my patients will know I will sit and interrogate you about when was your last medical checkup, when did you have the gynecologist check your gynecological wellness, and then give them a bit of breast awareness as far as why they have presented to me and the importance of early detection of cancer and what my role in their lives as far as early detection is.
So we'll come to that, but look, over the years, there's been a emphasis on women having to examine themselves, the breast self-examination. But of course, there's an increasing amount of evidence showing that in itself is not sufficient. That may indicate to them that there may be a problem, but by that time the problem may already be advanced. So the ultimate diagnostic techniques are the ones that they have to come to. But what's the real role of self-breast examination for the females out there?
All right, so breast self-examination, I believe, is crucial in any young girl who's already developed breasts. So at the moment of maturity during puberty and telarchy, which is the maturation of the breast tissue, young girls should be starting to examine their breasts and be aware of their own structure of the breast, texture of the breast, and growth of the breast. With that, I confront our women and say to them when they ask, well, I don't really know how to do it. It's so intimidating. I look at these charts and I don't know if I'm doing it well and everything feels like a lump. So I reassure them and I say to them, I said, we are so aware of our gynecological health, our vaginal health, whether we're getting a regular period, whether we're pregnant or not. We know how to find that gynecologist if we have pelvic pain. Yet we completely ignore our breast. Sometimes we don't even remember what bra we're wearing and whether the size needs to change as we increase our weight or not. So the breast self-examination, I believe, is crucial for women to be very in touch with their bodies. It does not replace diagnostic procedures, but where it brings home to ourselves as women is that, hey, my breast can have disease, not necessarily cancer, but cysts, lumps, pains, and so forth. I need to be aware of them so that if there is a problem, I'm able to go and seek help from a medical doctor and not just ignore and one day by mistake touch and say, oh my God, what is this now? And we have no clue when it came or what it means to us. And
most cases, I mean, look, you will find patients coming there and they're asymptomatic and
Yes.
you'll start picking up some kind of lump, or whether it's benign or cancerous. And it's important for them to actually try and have a sense of awareness from the beginning, and also get used to the idea. So when they do come, even that fear factor of having to go for a diagnostic procedure is somehow dampened a bit.
Yes, to a very
limited extent.
Limited extent. That
right.
fear factor will always be there.
Okay. Look, so we'll be discussing those techniques and the procedures that you conduct in terms of the diagnostic techniques. But I thought perhaps it'll be just a good idea if you just make people aware of the types of cancers that there are. Obviously, there's some common ones, and just give them some kind of idea. I think we have a slide 2 there, that will just show us the types of cancers and what do you really see.
All right. So the commonest cancer in the breast is actually from the origin of the cells in the duct, the breastfeeding duct. So when those cells become confused and abnormally dividing, then start affecting adjacent cells and then just are limited to the duct, you will see a condition called ductal carcinoma in situ. And that is a pre-cancer, and it's crucial that early detection mammographically, we find that as microcalcification grouping or clustering on an X-ray. So ductal cancer, so the breastfeeding duct cancer is the commonest, and that bottom of the slide where it says invasive breast cancer shows the ductal carcinoma in situ now invading the wall and causing breast cancer as we know it. Lobular cancer is then the next commonest cancer. So ductal cancer is about 76% of breast cancers, and then the lobular cancers, the breast milk-producing cells in the supporting structure of the breast tissue.
I think there's another slide on that in the types of cancers that you have. And so the one you find most common that you've detected is the
invasive ductal cancer.
Invasive ductal cancers.
Yes. The DCIS is crucial because at this point there's 8 times the risk of it becoming an invasive duct cancer. So that's the pre-cancer we screen for. And there will be no obvious symptom in the patient. She will come in for screening completely asymptomatic, and then we see these calcification clusters or segmental grouping of calcification affecting a duct.
Okay. And when you do detect these cancers with your patients, do you find that a majority of them are unaware, or you found that a number of them already knew by the referral doctor? Which is the greatest scenario in your practice?
All right. So screening, mammographic screening is really when they are asymptomatic, and really it is a very big shock to most women, and they're commonly in denial once a lesion is detected and then a biopsy is suggested. Unfortunately, there are still very many symptomatic women who come through. That means already having a lump or a lymph gland in the underarm or a breast a nipple discharge. By then, already the symptoms are suggesting an advanced cancer once symptoms are. And that's where we need to target women as to that self-examination with annual screening to reduce the women who come in symptomatically and are rather found on screening mammography.
Okay, so we'll be taking an ad break shortly, and after that we'll be discussing some of the risk factors. So inshallah we'll be continuing with the discussions, and then the lines will also be open. We're hoping that you can call in and pose your questions to Dr. Nadia Jajbai about her screening techniques and the trying to find a way to diagnose your cancer before it's too late. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters Comprehensive Chat from the Islamic Medical Association. Tonight we got Dr. Nadia Jajbai, an expert in diagnostic techniques in detecting breast cancer. And we were just discussing the introduction in terms of the different types of breast cancer. But I think the time has now come, perhaps before the callers start calling in, the viewers start calling in, is to the risk factors. It's pretty important. I know it has been mentioned many, many times, but we need to repeat certain important things always.
Yes.
And maybe we can just start with one or two risk factors that you want to discuss.
All
I know
right.
there are many,
Mm-hmm.
but the more important ones, and we can just start going through them.
All right. As far as breast cancer, there's a steep increase with age.
Okay.
So between 45 and 50, the breast cancer risk steeply increases as before that age group. However, I must say at the same time, there has been an alarming increase in incidence in younger women. So I've got numerous patients in their 20s and 30s, and that was not the norm just 2 decades ago. So by lifestyle and by genetic risk, we're becoming more and more aware of younger breast cancer. So age is a definite risk. The next alarming risk is called density of the breast, and that is over and above a very genetic thing. So we are born with dense breast if we've inherited that type of tissue, and it accounts for about 5 times more the risk at menopause than a woman with less dense breast, and that is significant. Most patients...
You mentioned at menopause,
yes.
sorry to interrupt you. So before menopause?
Before menopause, the density of the breast is acceptable because of the premenopausal status. So we still have hormonal stimulation of the breast tissue and the maintenance of the fibroglandular breast tissue. So with age at menopause and density, then you've got this 5-fold increase of risk.
It's a compounding factor.
Yes.
And in terms of the genetics, you mentioned genetics. When we were at medical school in our time, I mean, it was, like you said, it was predominantly seen white females, then more so in Indians compared to the African black. But right now you see an increasing incidence. Is it a genetic role, or was it missed before because of socioeconomic conditions? People couldn't get in for diagnostic techniques. Maybe they got more access to healthcare.
I think it's manifold. The genetic risk, I think, is overemphasized.
Okay.
They're only up to 10%, and that's still an overestimation of genetic risk factor towards breast cancer. By the way, while we're on that, the BRCA1, so the BRCA1 and 2 genes, were actually formulated in Ashkenazi Jewish and Afrikaner population. Alhamdulillah, I am made aware that, at our research groups are now concentrating on our native population now and trying to research the genetics related to South African population. We've also got our indigenous Asian population that come with their own genetic risk. So I've got families that are affected, many families that are genetically affected, and inshallah they will start with the Asian population as well, but the concentration now is on the black population of South Africa, which is crucial.
Alhamdulillah, at least work is being done in that area,
Yes.
which is very, very important. And that's important because those that have a genetic predisposition and have been told about it, obviously they'll need to come in for screening earlier,
Yes.
and of course more frequently.
Yes, so with a genetic predisposition, we're saying first degree or second degree relative or multiple, either with breast cancer, colonic cancer and pancreatic cancer, which are all related, and also melanoma, which is in the Caucasian population predominantly. Then screening should happen at 30, or the guideline is the youngest member of having in the family who had breast cancer. So if they develop breast cancer at 40, then you would come for screening a whole decade before that. So that would be at 30.
Okay, but in general, we'll come back to the different age groups when they should be coming in for men.
Yes.
There is a big role played by estrogen, or isn't there?
Yes, there is. So a lot of our risk factors are hormonally driven. For example, early menarche. So your first period as a young woman at puberty. We're seeing younger and younger women at age 9 now.
Sorry to interrupt you, we've got a caller.
All right.
Assalamu alaikum.
Assalamu alaikum.
Ji, brother, go ahead with your question.
Ji, When I was a doctor, I was reading one of those medical chronicles in the United States. They found that the HMTV virus that causes breast cancer, can she comment on that? It's a human memory tumor virus.
All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Look, these factors are still being researched, so there's no concrete scientific evidence that it is a definite risk factor, and Allah knows best. So time will tell now with research whether that is a true risk factor or not.
Jazakallah.
Jazakallah for a very interesting question, and of course we'll be looking out for that. It has already been mentioned abroad, but I suppose as time goes we'll hear more about that. Before the call, we were talking about menarche, so the earlier onset of menses in a young girl predisposes her to a greater risk.
Yes. So we're seeing younger and younger girls, younger age of menarche. And this is really related to the exposure of the breast to the ovulatory period. So also late menopause on the same effect. Women who are not having any children or have children much later after 30 are also predisposed for the very same reason. A woman who was had a pregnancy or breastfed would have had less menstrual period and less stimulation of the breast in that period of time. So breastfeeding also crucial. If women have breastfed for a year or more, it becomes the only risk factor that we know that slightly decreases your risk.
So again, our Islamic teachings, where we've been encouraged to breastfeed for at least 2 years, and of course in terms of our Islamic principles, try not to delay pregnancy for too long. So those kind of lifestyles that have been taught to us through our teachings coming through again here. So the protective factors that you mentioned in terms of lifestyle would be breastfeeding, and then there's a role that exercise plays.
Yes, so women who exercise have a better regulation of the estrogen, and they tend to lower the estrogen levels, especially at the crucial time of stimulation during the menstrual cycle. So that also comes hand in hand with our weight issues. So women with a body mass index over 30, so that's your weight divided by your height squared, more than 30, are now at direct risk. Before menopause, if there's a gradual increase of weight, but at menopause, definitely to be overweight is a direct risk for breast cancer.
So another negative in terms of overweight, of course, there's lots of these cardiovascular diseases. The number is at the bottom of your screen. Please do call in. Dr. Nadia Jajbai, radiologist, discussing breast cancer. We'll be touching on, I think, what we'd like to discuss, of course, is the type of diagnostic techniques. In the old days, we had this analog mammography. Today, we've got digital mammography. The pickup rate is a bit higher. But one of the things that happens when you ask a female to go in for a thing, immediately there's a thought, the fear, what if it's diagnosed? But you rather know than not know. And at the same time, the fear of the procedure itself. Perhaps we can just discuss that. I mean, it's with the new techniques. What kind of procedures are you conducting at your practice?
All right. So the dreaded mammogram, I call it.
I think we've got slide 5 on the type of equipment that comes.
Yes. So alhamdulillah, technology has advanced now, and we used a digital mammographic technology, which has a very gentle compression on the breast. So if you ask women who have had recent mammography with the latest technology, they will tell you, no, it wasn't painful at all. In fact, besides a bit of discomfort, nobody really wants their breast to be compressed between two plates. But with the necessity of it, it's not really painful. Before, it used to be likened as a nightmare, and many women would put you off from going for your examination, just saying, no, it's terrible, just don't go. But alhamdulillah, times have changed, and with the new digital technology also having decreased radiation dose and better resolution, alhamdulillah, we're in a better time and tolerance for for mammographic examinations. I don't think that fear factor will ever go away. I myself,
we can have slide
I'm speaking from experience. I mean, as somebody in the know and really knowing the need for myself to go for a mammogram, I was also terrified the first time I had to have a mammogram. However, alhamdulillah, it is very tolerable, like I mentioned, and very quick and easy in the right hand. So now we have dedicated technicians called mammographers who are trained to position and a very comfortable, quick experience for women undergoing mammography now. The fear factor also comes from not only the actual mammographic examination, but actually the diagnosis. Alhamdulillah, that is in Allah's hands, and we prefer that we know about a disease or a problem that's going to ail us in its early stages rather than when it's already advanced and there's not much hope for remission or cure.
Yeah, I think you've got a picture here, I think it'll come up on the screen just now, where a woman is just about to come in for a mammogram. She's already in the waiting room and she's getting called up, and a whole lot of thoughts going through her mind. Why did I come? Maybe I shouldn't have come today. Do these ladies express that to you?
Yes, definitely.
Slide 9.
A lot of women will confide that, you know, they were not going to come. In fact, it took a lot out of them to actually present themselves for the mammogram. And it might have been their doctor's third year giving them the request, and they finally got the guts to come through. What pushes most women is a recent friend or family member who's just been diagnosed, and then that fear of the examination is overridden by an undiagnosed cancer.
And the picture is now showing some images that you pick up, Nadia.
All right, so these are digital mammograms, and we're looking for cancers, and you'll see the woman pointing at a little nodule. So we're seeing earlier and earlier lesions where you're not even aware or have a symptom of the lump, and we're detecting it early. And that has a direct impact on your survival and quality of life.
Okay, we'll be coming back to that just now. We'll take a short ad break, so stay with us, and we'll be taking the discussion further. And also, please do call in. Nadia is waiting for your calls. It's a very important topic, so we really need to be aware of our responsibilities. And that's also for the men in terms of encouraging the women, their family members, to come in for these procedures. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters Comprehensive Chat. We're discussing breast cancer. It's Breast Cancer Month. It's a leading female cancer in South Africa. Dr. Nadia Jajbai, a radiologist, is an expert in the diagnostic techniques that we use today, digital techniques, mammogram. Very, very important that you should go in and get your breasts examined and screened for cancer. And earlier detection has its benefits. Allah subhanahu wa ta'ala has told us to look for a cure. For every disease there's a cure. But also at the same time it's our responsibility to look after our health. And one of the responsibilities is obviously to do some screening. We were discussing some of the risk factors, and we showed one or two, an image of a cancer that you see on a mammogram. We didn't cover all the risk factors.
Yes.
And we spoke about the early menarche, the late menopause. We spoke about the weight, person delaying the birth, those that don't have any children. IVF, does it play some role in it? Those
Yes.
that are looking and have infertility issues?
So, alhamdulillah, this is where we deal with the lifestyle of our particular era now. Women delaying pregnancies now after 30, to be in the workplace. Now fertility issues start playing a role. So with the hormonal stimulation of fertility comes increased risks towards breast cancer. Also women who have been on long-term contraception, so more than 10 years of continuous contraceptive use, oral contraceptive use. And that also would have been in that earlier period when you're in the workplace or studying, and then delaying the birth process for a later time. Hormone replacement therapy was a very well-known risk factor a few decades ago, and brought the breast cancer risk into the media. And then there was a drop in use of hormone replacement therapy. But at the moment, with the refinement of different hormone replacement options, and not only combined therapy being progesterone and estrogen hormone replacement therapy. Now we have very low dose estrogen only therapy. We are seeing many women making informed decisions about using hormone replacement therapy. But I do believe, both on our doctor's side and on our patient side, to work together about what are the possible side effects of hormone replacement therapy and what is its risk in myself individually towards the cancer risk. So, combined estrogen progesterone pill between 2 to 5 years will increase the risk towards breast cancer.
Okay, so in terms of the postmenopausal woman who needs a hormone replacement therapy, the latest evidence, obviously it's an ongoing thing, it's very controversial. Your recommendation, they should continue with the HRT for a certain period of time and then pause after that?
No, so what... for each patient, it should be individually discussed with their gynecologist. Using mammographic screening as a tool to make sure there are no contraindications, and obviously the patient's medical history. So hypertensive diabetics who are overweight with clotting risk factors and a smoker would be just a disaster before we even consider the cancer risk. As far as the cancer risk, we tell women who have genetic predisposition, who are grossly overweight and who have already used contraceptive for a long period of time, to rather make the decision towards not using hormone replacement therapy. But this is really advised using the gynecologist's advice.
So it's individualized treatment. We got a caller. Assalamu alaikum.
Wa alaikum salam. Doctor, I would like to know, there's so much talk about the type of bra that you wear. You shouldn't be wearing tight bras or a bra with pins in, or slip with a bra. How much truth is in there?
It's a very good question.
Jazakallah khair, sister, for that very important question. Look, there is a myth that the type of bra can affect the breast towards breast cancer. That is a myth. However, our breast health is very important. What we tend to do is we say, okay, I'm a 36B, and now we stay 36B no matter how much weight we are gaining. We squeeze into the same type of bra, and we're quite shy to go and have somebody aid us with our humility to actually size it for us. I'll encourage women to realize that it's more for our breast health rather than the cancer risk that the bra is important. A tight bra damages the fatty tissue within your breast. So we've got two main types of tissue in the breast, the glandular tissue, the milk-producing tissue, and the fat tissue. When the fat tissue is constantly compressed by an underwire or a deformed bra not washed properly, a tight bra then causes a condition called fat necrosis. So the fat in our breast starts dying, and it can form these very lumpy nodular areas where your bra line is, and these sometimes can form individual lumps that look like breast cancer. So you might need to undergo a biopsy for fat necrosis, which is obviously what you don't want. So tight bras and sleeping with a bra is also not encouraged for the very same reason. Very large-breasted women do find better comfort sleeping with a t-shirt bra just for support, so that would be acceptable, but not anything that's compressive on the breast. So the tight bra is discouraged. Make sure you check your bra size and your cup size. And underwires must not be deformed in the wash, so it shouldn't poke into the breast. And when you do wear underwires, you shouldn't really feel you're wearing a bra. If it is too tight, then you need to reassess what type of material and what type of bra you're wearing. Otherwise, there is a potential to damage the underlying tissue.
Jazakallah.
Jazakallah khair for that question.
Wa
It was a very good question, because this is a common myth in the community. But at the same time, you've highlighted the importance of the type of bra and monitoring the size of the breast, and it's also part of the education. The lines are open. The number is at the bottom of your screen. Please do call in. Dr. Nadia Jajba is here to answer your questions on screening for breast cancer. So we were talking about the hormone risk, and that one of the other things that we were reading about recently is, of course, it's well known that smoking and alcohol are risk factors for many cancers, and breast cancer it's also implicated.
Yes, look, smoking not directly. I think smoking for all cancers, because of its effect on our general health and on the DNA as well as time goes and as we age. I'll come back to smoking as far as our breast health, but alcohol is definitely a direct risk factor for breast cancer. So daily alcohol intake of more than 12 grams, and that would be at least 2 glasses of wine, they say. And if people are indulging in spirits, that would be even a lesser amount that would impact. And that's also important for male breast cancer. So men who have been indulging in alcohol, that also represents a cancer risk for them. I mentioned about the smoking. So smoking, incidentally, besides the breast cancer risk, which is, like I said, not a direct risk.
It's a relative risk.
It's a relative risk. Affects the breastfeeding ducts and causes over and above inflammation than our hormonal changes. So will cause a horrible secretion and often cysts in the breast and green nipple discharge, which you do not want to. So I hope I've put all the smokers off as far as the breast.
And of course, we are so lucky that alcohol is forbidden for us. So inshallah, we will not have that risk factor in the Turkey. So the lines are open. Please do call in. Nadia will answer your questions. The other thing that, I don't know if you've read about this, but they said people that have a very different type of work schedule, like night shift, and they have a higher risk. Is there some truth in it?
Yes.
There's a call. Assalamu alaikum. Assalamu alaikum.
Wa alaikum salam.
Hi, sister. Go ahead with your question.
Alhamdulillah. I would like to know if an underwire bra is permissible.
Permissible in terms of?
Of wearing.
All right, sister. Assalamu alaikum wa rahmatullahi wa barakatuh.
If it's a good idea.
All right, so.
Is it good to wear? Okay, Nadia will answer that, inshallah.
All right, so underwire bras, there's no real risk for the underwire itself. It is really related to whether it's very tight on your breast or not. So if you wear an underwire bra, you can. So it's not contraindicated and it's not directly related to a cancer risk. However, the underwire must not be too tight on the breast. We also tend to buy a bra and then throw it in the wash, and it gets, if it's hand wash, it gets deformed, the actual wire, and sticks out in the parts of the smiley face towards the end. And that, I mentioned earlier, that could damage the breast tissue if it pokes into the breast. So if you are going to wear an underbra, it's not a problem, as long as it's not too tight and it's not deformed in the wash.
Okay, Jazakallah khair for that question, and we'll take another ad break, and after that we'll be in the last segment of our program tonight. So please do stay with us, and we will be with you shortly. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, comprehensive chat by the IMA. Today we're discussing breast cancer. It's Breast Cancer Month, discussing prevention by trying to diagnose early, and also some preventative techniques. We were talking about the risk factors, and we mentioned this interesting concept where people that are on night shift and there's some kind of a change in their hormonal profile, it seems. Can you discuss that a bit more?
All right. So what they found was that in night shift workers, there was an increased incidence of breast cancer. So they tried to explain why. And this really depends on the diurnal and nocturnal rhythms that we have hormonally. As you're aware, during the night, our growth hormone is secreted while we sleep. There's fine balances between that balance and hormonal effects on our estrogens and progesterones and also our hypothalamic axis. So from there is the risk towards breast cancer. When they used to mention that risk factor, they would also mention the women who came from the legacy of diethylstilbestrol, if you remember,
yes.
in pregnancy,
Yes.
and these babies that were born. So it's not only the women that were taking these very high levels of estrogen. To fall pregnant and so forth. They were actually the children that were in utero, so the next generation of women who were exposed to had a higher risk of breast cancer. And then comes the radiation risk. So high dose radiation for lymphoma, for other cancers as a child,
predisposes.
Towards breast cancer.
Yeah, so it's really, really multifactorial, and obviously a lot of that is sometimes not preventable. Obviously, if you've got a lymphoma, sometimes you have to go for your radiation. We do have a few minutes left for this program. The lines are still open, so please do call in if you want to ask Dr. Nadia Jajbai a question. Today, the type of images that we get are much better than what we used to. And obviously it helps you guys with the type of digital images you're getting. I think we got another slide on that. And you think with time it'll get better and the diagnostic techniques will improve?
Technology is evolving very fast, so we have to keep up with the times and improve our imaging.
Slide 7.
The bottom X-ray images of an analog mammogram, you can't even see the skin and the nipples in that breast, and the contrast between the fat and the milk tissue is very poor. And yet the digital mammogram to the upper left shows the skin, the nipples, and the contrast between the fat and milk tissue. And this aids us in early detection. So very small sub-centimeter lesions. You'll see a spiculate mass on the right-hand side. So that's a very irregular lump that's now destroying surrounding tissue and suspicious for breast cancer and would need a biopsy.
Okay. We have a caller. Assalamu alaikum. Assalamu alaikum. Okay, so Nadia, in terms of there's quite a few messages you want to obviously send home, but one of the problems we have is obviously a lady that has a painless lump, and that can actually be a real, what you call it, a negative factor, because she's going to seek help later.
Yes, so this is a topic very close to my heart, Yaqub, because I feel almost helpless when a patient comes in and she says, look, I've had this lump for 3 to 4 months, sometimes even 6 months.
Longer.
And because it was painless, she didn't act on it. As women, we act very competently and very swiftly to pain. And ironically, in the breast, painless or a pain-free lump is our enemy. The painful conditions are often the inflammatory conditions like cysts and the benign lesions. However, I must mention that there are exceptions to the rule. I have seen our younger patients complain of pain in the breast, and there has been underlying breast cancer. So please, sisters, if there's a painless lump, do not leave it alone. Go in for an examination. Go to your GP, go to your gynae, come in to us for your clinical examination. Let's get to a diagnosis.
We have a caller. Assalamu alaikum. Assalamu alaikum.
Alaikum salam.
Go ahead with your question, sister.
Assalamu alaikum, doctor.
Walaikum salam wa rahmatullah.
I just want to find out sometimes, not really related to the breast cancer, but is there sometimes like a lesion, like, that looks like a pimple, but it doesn't excrete blood or pus or anything. Is it some cause of concern to just maybe have it checked? Is it like maybe something cancerous or not?
Just mention the question again, it's a bit soft.
Okay, so sister, were you mentioning a small little pimple or lump on the skin or within the breast?
On the skin.
On the skin. All right. So on the skin, if there is a little lump or protrusion that might look like a little boil, so if it's red and has a little bit of pus coming out of it, we think of infections like Staph aureus infections that can infect a follicle. Commonly I see in the breast or the chest area are what we call epidermoid cysts. So these are little subcutaneous, just under our skin surface, there's a little cystic structure that can swell up, get infected, get inflamed, and often painless on the skin. What I would advise you is to have your trusted doctor, either your GP, your gynae, or ourselves in breast care centers, to examine you and then advise you whether it is something of concern.
Jazakallah khair. I hope that answers your question, sister.
Okay, no, Jazakallah khair. Indeed, Jazakallah khair.
Jazakallah for the question, Nadia. Jazakallah khair for the answers to the questions for the viewers, and also highlighting some of the important issues on a very, very important topic. I'm sure there's a lot more you would like to cover, but we're reaching the end of the program. Time goes very quickly. Any take-home messages in this important breast cancer month?
Oh, you want me to talk for a few hours?
Yeah.
Well, sisters,
show us your summarizing skills.
All right. So, just in summary, sisters, I'm very passionate, about breast cancer awareness. Please do not be fearful to come through for a mammogram. Early detection is the key because it gives you a better chance for survival of breast cancer, which is something we take for granted in this time and age, and less radical treatment. Mammograms are not painful. They can be competently done, and really take care of yourself. This amana, what we've been given, a healthy body and a sound body we need to maintain. Do your breast self-examinations, do your clinical workups, and come in for screening, inshallah.
Jazakallah khair, Dr. Nadia Jajbai, for coming through, and to you, the viewers, for watching this program. A very important one tonight in terms of breast cancer. And also for the men out there, please do encourage your female relatives, wives, spouses, daughters, to pay attention to this very important topic, because if it is picked up early, inshallah, there is a cure. Everything is still in Allah's hands, but we do our best. And until next week, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.